You didn't mention reimportation from other countries. Do you think that would work? Is that part of your plan, or is that a bad idea?
That's a good idea. So reimportation is that if American drug manufacturers can't either get their prices in line or produce what the American people need, then we can reimport the drugs from other markets and other producers.
But you want to try those other approaches first?
You know, I think they'd be hand in hand because, again, the American system right now just rewards profitability. And so if an American drug company thought that we were going to bring in competing goods from another market, then that would actually help get the prices down.
Okay, and you're an advocate of a Medicare for All plan, but you've added a component of holistic health care under your version of Medicare for All. How would that work?
So I'm Asian, many of you might have noticed. And there's a whole heritage of different holistic medicines and approaches to health. And different things work for different people. When my wife gave birth, she had a hard time feeling healthy again, and she saw an acupuncturist, and that was immensely helpful. My mother, who's newly retired, is an artist now. She's seen an herbalist, and that's very helpful. And so our insurance and our healthcare program should cover different types of holistic treatments that people find constructive and helpful and beneficial. Because many of these treatments have proven effects for at least some sets of people, and instead of having one standard or one size fits all, we should let Americans decide what works for them in terms of their own health and well-being.
Would those programs exist outside of FDA approval process? They would not need any kind of FDA approval or proof of their efficacy before they could be covered?
Many of the treatments I just described, right now, they don't require FDA approval because it's not a drug. Like you can't, so it's not that these holistic treatments take the place of traditional drugs. So most of the things we're talking about, those treatments, would not require FDA approval. That's correct.